Hi Mariners, this is Mohan Das with MFA exit exam set number 3. MFA exit exam questions and answers set number 3, January 2023. Question number 1. OPQRST is used to assess, answer, pain. What I had given below is just for your information. It will not be there in the exit exam question. O. Onset of the event. P. Provocation, palliation. Q. Quality. R. Region, radiation. S. Severity. T. Time. So the answer for OPQRST is pain. Question number 2. Which of the following should be done for a person experiencing a heat-related illness? Answer. Apply cool, wet cloths. Question number 3. The recommended oxygen flow rate for nozzle cannula in brackets nozzle prongs is, answer, 1 to 6 liters per minute. Question number 4. You feel a sudden sharp pain in the bottom of your left foot. You look at the bottom of your left shoe and see a tack sticking in your shoe. What type of wound do you probably have? Answer. Puncture wound. Question number 5. To prepare a completely amputated part of the body for transportation to hospital with the casualty, you should, answer, wrap it in clean, moist dressings and keep it cool. You can keep it in the ice box or ice water. But the amputated part directly should not be in ice or ice water. It should be in separate polythene cover. Wrap it in a clean, moist dressings. Put it in a cover. Then put it in the ice box or ice cold water. Question number 6. Which should be a part of your care for a severely bleeding open wound? Answer. Apply direct pressure and elevate the injured area. In brackets, if no broken bones. Question number 7. Hypovolemic shock results from, answer, decreased volume of the blood. So this was the choice in the question. However, hypovolemic shock includes large burn area, burn injury, okay, then diarrhea, severe vomiting, severe diarrhea, all this will come under hypovolemic shock. The fluid loss from the body. Question number 8. What should you do if you think a victim has serious internal bleeding? Answer: call your local emergency phone number for help. because there is no first aid you can do for internal bleeding. Nothing much you can do. Question number 9. Manual support of the head and neck of the patient with a suspected spinal injury can be released. Answer: when the patient is fully immobilized to a backboard. So if he is given backboard, then you can remove all this. Head and neck support, manual support. Question number 10. Which of the following behaviors reduces your risk for injury? A. Always wearing a safety belt when riding in automobiles. B. Limiting intake of alcohol. Answer D. Both A and B. Question number 11. A conscious casualty who has suffered a stroke becomes unconscious. To keep his airway open and help him breathe, you should: answer, turn him into the recovery position with his unaffected side down. Question number 12. How can he reduce the risk of disease transmission when caring for open bleeding wounds? A. Wash your hands immediately after giving care. B. Avoid direct contact with blood. C. Use protective barriers such as gloves or plastic wrap. Answer D. All of the above. Question number 13. Shock is best defined as: answer, inadequate circulation to the body's tissues. Question number 14. You have tried to control a victim's bleeding with direct pressure and elevation, but the bleeding doesn't stop. Where would you apply pressure to slow the flow of blood to a wound on the forearm? Answer, inside the arm between the shoulder and the elbow. So, by now you should know we have indirect pressure points, 22 indirect pressure points. Okay. 11 on the right side, 11 on the left side of the body. So this is one of the indirect pressure point. So bleeding control, there are 4 steps. One is the important one is you are applying direct pressure. Number 2 is elevation if the injury is in the limbs. Number 3 is applying pressure on the indirect pressure point. And the last resort is tourniquet. Applying tourniquet. Question number 15. The most critical factor in defibrillation is: answer, the time from collapse to defibrillation. Because you start CPR within 3-4 minutes and bring the AED and connect it as soon as possible. The reason being, after 10 minutes delay, that victim will be declared as brain dead. So that is the time from collapse to defibrillation is the critical factor. Question number 16. Dressing and bandages are used to answer help control bleeding and prevent infection. Question number 17. The AED will shock a patient. Answer in ventricular fibrillation. So when you connect the AED, it will analyze the rhythm of the heart, and if the heart is in ventricular fibrillation, then it will recommend a shock or it will give a shock. Question number 18. Most injuries are due to situations that answer you have some control over or could have been prevented. Question number 19. When using an AED on a patient who is wearing a pacemaker, place the electrode pads, answer, at least 1 inch away from pacemaker. Question number 20. Where is the carotid artery located? Answer, on the neck to the right or left of the windpipe, on both the sides. Carotid artery. Question number 21. The most immediate serious complication associated with burns is, answer, shock. So in burn injury, the first degree, second degree, third degree, okay, you can manage them, but the body surface area, if it is very large, then the problem comes. Then body fluid, the plasma escapes from the body, which will lead to shock. Question number 22. In determining the amount of body surface burned, the area of the palm of the hand represents dash percentage of the body surface. Answer, 1%. So when you are assessing the body surface area, you all know the rule of nines is followed. In that, 1% is allotted for the palm of the hand. Also 1% is allotted for the groins. Question number 23. An abrasion is, answer, a scrape or rubbing away of the epidermis, the topmost layer. Abrasion. Question number 24. On an infant, where would you check the pulse? Answer, inside the arm, between the elbow and shoulder. Question number 25. A soft tissue injury resulting from the impact of a blunt object is called, answer, a contusion. Question number 26. For an infant who is choking, you would perform, answer, back blows and chest thrust. 5 back blows, 5 chest thrust. Question number 27. Tetanus is a condition, answer, that can be prevented by immunization. We all know we take TT injection, that is for tetanus. Question number 28. Breathing emergencies may be caused from A. Asthma, B. Hyperventilation, C. Allergic reaction, D. Injury to a muscle or bone in the chest. Answer E. All of the above. Question number 29. Responders involved in wound management should consider, answer, all open wounds are contaminated to some degree. Question number 30. A person who is unconscious, not breathing, has a weak pulse, needs, answer, rescue breathing. With these 30 questions, your MFA set number 3 is completed. I'll be soon with set number 4. Thank you. Give your feedback in my WhatsApp number or email. Bye.